if you're good to people, people are going to be good to you. And if what you do is, if you're helping people, if you're helping change people's lives, then they're going to talk about it and they're going to, spread your name more than you need to. So.
All right. So Dr. Chad Teague is a chiropractic physician and founder of CodeChiro. He completed his undergraduate degree at the University of Mount Union with a major in exercise science and minor in chemistry. Oof. At Mount Union, though, he played football as well as wrestled. He is a graduate of Palmer College of Chiropractic, Florida. While at Palmer, he was an active member of Sports Council. Dr. Teague has multiple certifications, including Active Release Technique, otherwise known as ART, Full Body Certified, Selective Functional Movement Assessment, or SFMA, Rock Tape Fascial Movement Tape 1 and Tape 2 Certified, and Rock Tape Performance Movement Tape. In addition to serving and seeing athletes, a lot of professional athletes, including Odell Beckham Jr., Jarvis Landry, David Njoku, and several more. Joining me now is Dr. Chad Teague. Welcome, Dr. Chad.
How are we doing today?
Hey, we are doing well. How are things up in snowy Ohio?
Yeah, you caught me on a snowy day. We got quite a few inches outside, and it's kind of what postponed our interview from earlier today.
Yeah, sure. Yeah, no timing, and it's always been crazy. Of course, family up in West Virginia, they're like complaining about like 5 or 6 inches. I'm sure up north in Ohio, it's like nothing.
Oh man, we're in the snow belt, so we'll get sometimes just 2 feet out of nowhere overnight.
Yeah. And so where's your practice located? I know you're outside of Cleveland, but
yeah, it's Cleveland, Ohio, but it's east, kind of southeast in Mayfield Heights or Beechwood area.
Got it. Awesome. Very cool. Yeah. And so I'm really glad I got you on here because, I've found you through Instagram of the sorts, started learning more about you, saw what you were doing, saw you're posting up pictures, working with guys like Odell Beckham, Jarvis Landry. And I was like, this is so cool. Cause that was always something I was interested in, was wanting to work with athletes, as well as, so many people who are probably viewing this are also interested in that kind of field. And so a question that's always on my mind that I like to get to while we're talking is, how do you go from graduating from Palmer, Florida, to then going back up in your home state of Ohio, opening your own practice, starting to work with athletes? I mean, you got a 3-doc team now doing a lot of awesome things, to then working with these professional athletes, to going and knocking on OBJ's door saying, yo, what's up, bro? How you doing? I'm a little sore from last week's game. All right, cool. We'll go ahead, lay on the bench. Let's get to work.
Let's go.
I want to get to that whole evolution of that process, but let's take a step back and go at the beginning of the trilogy, with your chiropractic story, what got you into chiropractic, and what led you down to Palmer, Florida.
Yeah. Quick correction. We actually have 4 docs now. So we just hired, officially have a new guy he started his on schedule last week. So
nice. Very cool.
But yeah, so I originally, my chiropractic story, I would say, became early on in my career of sports. So I had a lot of small injuries through rib issues in wrestling, jaw TMJ type problems. And I just, especially the jaw issue was like the first one, started having issues there, went to my primary, didn't really know what to do, just kind of gave me some medication for discomfort and inflammation and sent me on my way. My dad was going to a chiropractor at the time. His name was Dr. Jeffries in Cambridge. Still talk to him today. He's awesome. And he literally fixed it in one visit. And I had immediate relief, which was just eye-opening for me at that time when, really, you're young and you're banged up and bruised. And you don't really think about pain in too much depth because it usually goes away pretty fast. And that was probably one of my first significant issues with pain for longer duration. So that really opened my eyes. And then in college, I had a couple rib issues with some strains. And again, same similar situation, went into our training room and then the urgent care and just medication and send you on your way. I ended up just driving down from school, from college, and getting treatment over the weekend. And then I was from being literally bedridden to because of so much pain to being back on the mat drilling on Monday. So that was a huge, again, another eye-opening experience, which really just propelled my path to becoming a chiropractor.
Yeah. Man, that's all. That's awesome. And that's kind of similar. I mean, in a lot of ways with what I went through. And I played high school football, was looking to go into college my senior year, ended up tearing my ACL. And so through the whole process, I got introduced to PT and rehab and stuff. And that's what I was really focused on. That's why I went and majored in exercise physiology. But then as I started to work with my chiropractor in college, I started to get aware of like all these other like subtle dysfunctions, for lack of a better word, that were going on. You know, I realized how weak my glutes were, my hamstrings. I had lower cross, some other spine issues going on.
Mm.
And that's what really related a lot of like, man, I wish I knew that stuff earlier while I was playing, you know, football. I had all sorts of injuries, low back issues. I had knee issues before I tore. It's like, I knew there was so much underlying stuff going on. So for me, it was like, I want to be put in that position where I could work with those athletes to get them better and get them well oftentimes before they even realize they have an injury.
Oh yeah. That's really the goal, is to get people at that young age. 'Cause, you know, we obviously can still work with people later in life, but it's fun to catch them before they have any of those significant injuries.
Right. Got it. Yeah. And so you went to Palmer, Florida. Is that like, cause I know a lot of times, like for me, I went to Life because of the doc I was working with. Was that similar situation
Same.
for you?
Yeah. Well, my one mentor in Cambridge, he went to Sherman. I went and visited there, and then continued on down. Didn't stop at Life, but the other associate was from Palmer, Florida, and he really enjoyed it, and kind of got me to want to go visit it. Once I went to visit that one, I was just like, oh yeah, this is it.
Yeah. On the beach.
Close to the beach. Yeah.
Yeah.
And it was like state of the art facilities. Everything was brand new, so I loved it there.
Nice. Yeah, no, it's pretty nice. I didn't get a chance to go there until I was already after going to school to Life, but it's definitely a nice campus for sure.
Yeah.
And so is that
One
your
of our
kind of,
associates? One of our
yeah,
associates is from Life,
nice.
Dr. Ryan. Yeah.
Got it. Yeah. Yeah.
So
Very cool. Very cool. Yeah, that's awesome. Yeah, I love Life. It's a great school. I always say like every school has got its own touch for each person, but at the end of the day, it's like you can learn what you need to learn no matter what school you go to, you know.
yeah, it's just a platform.
Exactly. It's 100%. It's a preparation platform, and each one's going to prepare you for the ultimate goal of passing your boards.
Yep.
And if you want to learn stuff like we went through all of your certifications, you learn, you know, that's just part of the process you do outside of school.
Yeah.
Yeah. And so was that your kind of ambition while did you already know like you wanted to work with athletes, do what you're doing now prior to coming in?
Yeah. I think I always wanted to work with athletes. So I knew when I went home to Cambridge and I did my externship there that I knew that probably wasn't going to be the place I should really settle. So I had an easy overhead start up in Cleveland where we started CodeChiro. It used to be Teague Chiropractic, Performance and Health, which is just word vomit. It's a terrible long name. So when my wife, who's the other owner and founder of CodeChiro, we thought that name was a lot more progressive and just kind of easier, kind of rolled off the tongue better, and would look better on apparel and stuff too. So, and then the code stands for cultivate, optimize, develop, and enhance. So kind of what we do with our patients when they come into the office. So, you know, we started up there. I kind of lost where I was going with that. What were we talking about?
So I guess you're going into opening, you're looking at Cambridge, then opening up,
Yeah. So, I forgot. So when I went up to Menor and started up there, it was a cash-based practice, which we still are now, self-pay. And that kind of allowed me to have longer appointment times, which allowed me to kind of take on more of that athletic realm on top of, providing the same service that I'm offering to athletes of all levels that I'm offering to regular people like us. So that's kind of what allowed me to kind of go down that path of seeing athletes. And I was in a CrossFit gym of one of my best friends, Scott Panchik. He's a pretty well-known CrossFitter in that world. So he's been at the games. I think this is his 10th year as an individual. And he's always on the podium, or always on the not on the podium, but he's always in the top 5 realm. So this year he's trying to get on the podium. But yeah, so that was kind of where I started seeing a lot more of high profile athletes, I would say, from CrossFit.
So you started
And
with him. He
then,
was like your first guy you were working with. Seriously, got it.
yeah, I was actually working with him through school. So
Got it.
that kind of worked well when I graduated, and we continued that process. And then
Was down
people
in
that
Florida, or was he in Ohio?
he was up here in Cleveland.
I got it.
So with working with him through school, obviously he came down once to Florida, but I would always come home and go stay with him, and we'd visit and kind of work on some stuff. And then people he would bring that were also kind of in that famous CrossFit realm kind of got my name out there a little bit better too. Then we had a local UFC fighter that I started working with pretty closely, kind of through a couple of her fight camps. She
Mhm.
then moved to Vegas. She was in a title fight, so that was a lot of good experience with that as well. Um, and then I just started kind of getting my name out through social media. One guy ended up reaching out to me. Who was on the Browns, and then before the appointment was over, he had like three other guys he was FaceTiming to come over, and it just kind of spiraled from there.
Yeah, that's
So
awesome.
yeah,
Yeah, that's pretty cool. It's a wild ride for sure. And
yeah, I would say that was just. I mean, it wasn't like any specific. That was definitely my end goal,
mhm,
um, and I just try to put myself in the right situations and treat people right, and just be a good human, and that kind of uh, is probably the best advice I would give on that.
definitely, totally. And just so get into like the working with the athletes part, how does your approach with working with an athlete differ? Obviously, there's obviously going to be differences with their performance based and their goals they're working on, but how does it differ from, your average normal person to then working to an athlete to then how does that change working with these professional guys?
Like time frame wise, or
Yeah, everything. I'm sure there's a time frame wise, but more, I guess, treatment focus wise as well.
um, those athletes that are on like more of the contact sports,
Hmm.
um, there's a lot more soft tissue that's required. So I spend a lot more time doing that. Their appointments are, Jarvis, for example, is like he's a lot of time. So 2 hours per session, and then like 3 to 4, sometimes 5 times a week.
Wow, damn.
So it's a lot of work.
Yeah.
He is an amazing human when it comes to just the amount of time and effort he puts into his body. So
Hmm.
all the respect to him and what he does out on the field, because he really puts a lot of effort into his craft.
Right. Yeah, 100%. And so let's get into some of the stuff that you're actually doing. I know you said your ART, you do some movement assessment work. So I mean, gosh, there's probably a million things in your tool belt, but if you just kind of want to discuss and talk about maybe some of the things you're looking for in these athletes whenever you're working with them, what do you primarily work on when you say soft
Yeah.
tissue?
So I would say in the beginning, I really look at movement dysfunctions. You know, being that I did play, a lot of sports growing up, I kind of I break down film a little bit too and see how they move when they're playing. When they have little tweaks or little injuries, I go back and kind of see what they were doing, what happened, to see if it was like a biomechanical fault, or if it's just not like a contact issue where you have a contusion. Um, so that would be my initial, I would say, and then
Mhm.
ongoing as I am treating them, is just kind of see how they move, see where their problems are. And then, yeah, when it comes to soft tissue, it just depends on the week of the day. If it's,
Yeah.
a contusion issue, we'll try to do some deep tissue laser, some lymphatic work, maybe some voodoo banding stuff, light Graston, you know, throw, a lot of things at, a lot of things at certain issues to kind of try to help with that healing process and get it happening a lot faster. A lot of ART.
Mhm.
I love ART. So I think it really helps kind of open up, not just like singular muscles, but whole multi joint.
Yeah.
When you talk about cross sections and um, you know, was it Thomas Myers that that book Thomas Myers wrote?
Yeah, I know you're talking about. I've not read that book, but I do know what you're talking about. It's
I can't, the fascial plane lines, but I
yeah,
forget what the name of the book is. So yeah, just kind of following a lot of those techniques and kind of blending a lot of a lot of the certifications you said. I blend a lot of them together and just kind of
right.
see what works, and just through that experience of, you know, this worked well for this guy, this worked well for this guy. So, you know, I just kind of plug and play when I can.
Right. Yeah. I like that.
I
And
know
I
that's
mean,
probably not a great answer, but
well,
it's
it
it's
is. It is in a lot of ways. Cause I mean, I understand there's a certain level of art to it. And that's what makes this stuff unique. It's not like you're doing the same thing for every single person. There's
no,
there's I guess for, there's the diagnostic component of it. There's the, I'll use their name in a different light, the coding of what
yeah,
the actual problem is and presenting that code and decoding and getting the person better and functioning better at max capacity. You know?
exactly. Yeah. And
Um,
it does. And that same person, I'm doing something the next week that's completely different because they had a
right.
different issue come up, or, you know, it's just really, and then I'd say a big portion of it as well is the education. So the athlete knows like what they should be doing. And, you know, it's more of a, team effort than just like me doing stuff to them. So trying to educate and inform them on a lot of the stuff that they can do outside of, you know, just treatment, with whether it's nutrition, supplementation, et cetera. Just getting them to become
Right.
the best versions of themselves.
Right. Exactly. Yeah. I
Because
love
yeah,
Yeah, that's good. And so it all starts too with that movement assessment. I think that's a critical component. Is that sort of how you figure out what parts to work with? Soft tissue work is basically where the
yeah,
movement dysfunction is, understanding the muscle and body parts that are involved with that.
yeah. On top of like their complaints as well, you know, all right, this is a complaint area, so I'll use a movement assessment, so like SFMA,
Mhm.
to kind of break down like, all right, the hip hurts, then, you know, let's look up into the ribs a little bit, down into the knee, see if there's, you know, some pronation issues in the foot,
Yeah.
make sure that that's not causing the impingement. Um, you know, that's SFMA is a great course. I'm wanting to retake it again with the other chiropractors in my office, so we can kind of all get on the same page with it, because I've taken it. Our new associate has, Dr. Ryan wants to, and then my wife, Mary, she hasn't taken that either. She's done FMS, so we're trying to
Got
just
it.
take it all together and just kind of bring it together.
Got it. Very cool. Yeah, and I saw Dr. Ryan. I saw he's certified in Factor, and I know there's a lot of people watching this that are probably like, I have no idea what they're talking about right now. We'll get into a little bit about that. Like,
Yeah,
if it's over your head, even a lot of this stuff I haven't even learned yet. But we'll get into sort of like the resources for education later, so you guys
yeah.
have that's blueprint going into school.
SFMA is Selective Functional Movement Assessment.
There you go. Yep.
Yeah, so that's what it stands for. It's the
Right.
clinician side. So FMS is functional movement screen. That's the like trainer side, or people that are doing personal training.
Yeah.
That then if they find a painful dysfunction, then they send or they refer to a clinician that does SFMA, and that's what breaks down like the pain
Right.
aspect of it. So
Right.
that's the two lanes. You can do both, but both are good.
Yeah. They're
Well,
effective.
the clinician can do both, but the trainers can only do S or FMS.
Oh, is that right?
Yeah,
Okay.
but like I said, they're both, you know, SFMA is seriously in depth stuff. So
Very. Mhm.
yeah, you got to study that one pretty good. They've done a better job of condensing some of the stuff to make it easier, but
Yeah.
that
Yeah.
was that blew my mind when I did that seminar.
Yeah. And it's Dan Cook, right? That leads that.
Him and
I know Dan Cook.
man,
I've
I'm so
watched his
bad with
videos.
names. Gray Cook,
Gray Cook. That's what it is. It
Gray
wasn't
Cook,
Dan Cook. It
yeah,
was
Gray
Gray Cook.
Cook,
It was
and
Gray Cook. That's right.
but there's a couple others
Yeah.
too that are involved as well.
Yeah. 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 Gray Cook. That's
Threw
who.
me off there for a second. I was
Yeah.
like,
No, I said Dan.
that doesn't sound right.
Wait, what? Can memorize any nerve and muscle insertion in the body,
Yeah.
but can't memorize people's names. No. Yeah, Gray Cook, his videos, and anyone watching this, look up Gray Cook. There's some of his videos that he shows on there, and he has some SFMA stuff on there as well. You can that resource to look into. It is really, really awesome stuff. I'm sort of been diving into that and learning
Mhm.
more of it.
Do it
Way
now
of,
while you're in school.
yeah, 100%.
and then you can start just watching people move in gym.
Yeah.
That's my another, big suggestion I have for if you're following with a lot of students is become a trainer or a CrossFit coach or a powerlifting coach or Olympic lifting coach, something,
Mhm.
and just become a coach so you get good at dealing with people and working on your bedside manner. And at the same time, you're watching people move and kind of pre-diagnosing them before you're really allowed to diagnose in your mind. And then, that might even help you, coach movement. And when you're coaching movement before you're, a Chiro or a PT or whatever you're ended up doing, um, you become such a better clinician on
Yeah.
just evaluation and just your ability to speak to people.
Yeah, that's a good point. Cause I get a lot of people that ask me stuff to do while they're prepping for Chiro school. And of course we try to nail down like build your time management, your schedule, get your work ethic, all that. So you're prepared for the load that comes with school. So you can be able to seize other opportunities while you're in school, go to seminars, workshops, all the like. But I do like that point. I think that's good for like a job
I
while you're an
didn't.
undergrad, is to get into coaching, because you're going to get extensive background and actually, and treating people and actually like figuring out what's wrong with the cause is actually wrong with many people. And you'll get like because I know it takes a while to get the eyes view for even looking for those little nuances in people's forms with their movement. But also, like you
Mhm.
said, the communication aspect is huge too, because I mean, that's probably arguably half of the interaction. It's not just what you're doing to the patient, but also how you're communicating and walking them through everything.
Exactly.
Yeah.
Yeah, I would even argue to maybe take some time off after your undergrad and just do like a semester or a summer of coaching or just doing it in your off time. I started coaching CrossFit when I was in chiropractic school.
Nice.
So that really helped me
Nice.
big
Nice.
time.
Nice. That's cool. Well, yeah, that's cool. What else? What I was going to say? I know. Yeah, I've been learning the factor stuff. I saw Dr. Ryan was certified in that. I don't know how much of
Yeah.
that do you guys do in your clinic, or is that just kind of
It
you guys?
really, we pretty much treat similar across the board,
Mm-hmm.
but factor is utilized. I'd say I took factor as well. I don't know if I have that listed or not, but I took factor, and
Got it.
I like the for baseball players or any pitcher really, or golf. Just we do a lot of stuff with movement. So whether it's cupping or grassed in or not needling, but things that are we're going to work the tissues on the outside
Yeah.
while we're taking them through the range of motion.
Yeah.
That's why I like ART so much, because that's essentially what ART is.
Right.
Um, so we utilize it. It just depends on the patient, but definitely a portion of our practice. So
Nice.
it really, when you add that soft tissue component on top of the adjusting people, that's the should be the gold standard. I mean,
Absolutely.
in my opinion. So
Yeah.
everyone has a different philosophy, but I think that the soft tissue component is extremely important with what we do. So
Absolutely is 100%. I've just been coming around to it, and I'm just now seeing the huge value in it. And now, is that something you start even with? I know for a lot of people, it's easy to see soft tissue work with athletes. You had mentioned, obviously, in your practice, you do, you see a lot of everyday folks as well. Is that something, do you do soft tissue work, movement work, similar to how you do with athletes with them as well?
yep, 100%. I'll teach, the same thing to one of my professional athletes on, breathing mechanics to increase their, explosiveness and, whatever sport they're doing. And then teach the same exact way to, Dan, who's 75 years old and it hurts to bend over, just teaching how to load and get the proper breathing mechanics. And that's one step of what we teach. But we have a system of protocols we'll go through and just to re-educate and get them up to speed so that they're not having those injuries come back again.
Yeah. Yeah, that's good. Yeah, it's just modifying it for each individual.
Yeah, I mean, everyone's different. So we take, we have a set of protocols, and we might enter it, different areas, but we all cover all of those anyway by the end of the time we're working with them.
Right.
So
That's right. So you kind of start with one particular, the number one area first, and you kind of start
Yeah.
different things. Got it.
Yep. Knock one thing out at a time.
Got
Try to, a lot of times when we teach certain protocols, it might fix 3 of their issues. So,
True.
just on learning how to hinge correctly, or, scat retraction correctly, just different things like that.
Yeah, that's good. Yeah. And some other things I've heard too, what's your average visit look like, or how much time does it take for actually taking care of an individual person? I mean, I know, like you said, if you're focusing on one area, it's not like there's going to be this huge drawn out thing, but obviously you want to spend enough quality time with each patient. So how long would you say your average visit is?
Average visit's about 25 minutes.
Got it.
So, 25 to 30. But again, I'd say that's what most commonly happens. I've started to accumulate a lot more hour-long patients. So people just, and it's essentially just, we have a 30-minute appointment, it's X. And then if you want to do an hour appointment, it's, the same thing. So that's kind of how it works. So you just, some people will travel from far away. So if they don't want to come, every couple, and say for example, they're once a month, and they're 2 hours away or 3 hours away, they'll get like a 2-hour appointment and come every 6 weeks instead of every 4 weeks.
Yeah. Got it.
Like that's one example of a specific patient that,
Right.
Again, the goal is to, get them to that more of a maintenance role, to where they're, just coming in to get that soft tissue and maintenance type work. But just depends on if that 30-minute is the average, but I've started to accumulate more of the hour-long ones.
Nice. That's awesome. Yeah, that's really, really cool. Yeah, something when I'm been learning, like, because I've been just focusing on the adjusting all the way through school. Then now I'm just starting to learn a lot of the soft tissue, the movement stuff, and implementing. And even now I'm in the outpatient clinics, so starting to implement some stuff there. I'm seeing some big changes in results. I know with you, it's kind of like that's just been the thing starting out. And that's kind of my hope and plan is starting out that way too. But have you noticed, or what's been your take on actually getting faster, quicker results with incorporating soft tissue on top of the adjusting and everything else? Like, how would you say, how much quicker or faster would you say that you're able to progress patients through their care?
That's a great question. I couldn't answer that because I've always incorporated soft tissue.
Yeah.
And I've been like, even when I did externship and clinic work, whenever I didn't see the soft tissue component implemented, I just felt like I was doing a disservice to the patient. Even if it's just like a minute of, some active, like soft tissue release, or some Graston, or, you're still, getting more blood flow to that area. So, like I said, I don't even know a good answer for how much faster it would occur, but significant in my opinion.
Yeah, sure. Yeah.
Significantly faster.
Yeah, I would agree with that as well. And for anyone, any student who's watching or listening to this, I guess we can get into some of because you would learn ART and all of the stuff while you're in school, right?
Yeah, I did I was full body ART before I graduated.
Got it. Awesome.
Took a little hit to the bank, but I still would recommend it, to everyone, just because it helped me a ton when I was in clinic down there, and it helps get people, if people know you do that, you're going to get a lot of your colleagues and other students around you that want to get treated by you.
Yeah.
And then you just get better. Just happens because you're just constantly working on people. So
yeah,
the more the more people you get your hands on, the better.
Yeah, definitely.
So when you do stuff like that, you're kind of, set yourself up for, more appointments.
Yeah, exactly. And you become the guy too that, like, all the other students, they want to come see you because you're the guy who can, who knows all this other stuff. And very quickly,
they want to learn from you.
Exactly. Yeah. And you'll get patients better, faster. I've already began to see it just in some stuff that I've been doing, which is super, super valuable. I definitely want to start attending these seminars. And so for, a lot of people who are watching this and you want to start to learn some of this stuff, incorporate this, even if you're treating athletes or non-athletes alike. I mean, like we said, this stuff is, you do both. So you do athletes and non-athletes, like it's all
It's
valuable.
valuable for everyone.
Exactly. And so just, I would say, and you can put input on this, Dr. Chad, is like, just go to seminars, figure out all the ones. Like we had mentioned a few, the SFMA, ART, Factor. I mean, gosh, I know you said you've gotten into rock tape as well. What are some other good ones, resources?
Dry needling. That's huge. I started doing that after, and it's been an amazing addition to our practice. I can't talk enough about how well that has worked and results for all types of different issues. It's helped my hands a lot too, because some issues that are really difficult to do with active release, where I feel like my hands are going to explode because I'm pushing in so hard, which even when you learn ART, they say like that should never happen. But when you have a 275 pound person that's all muscle, your thumbs are going to hurt. So I found that to get to the deeper layers and to really get a good result, and to even in the deep glute areas, it's just been amazing. So highly recommend dry needling or acupuncture, depending on your state, whatever they allow. That's a great one. I'm trying to think. Rock tape was fun because we did a lot of movement stuff in that one. So that was a good class to take. Everyone just thinks it's tape, but the director of rock tape that does a lot of that continuing education, he's awesome. His name's Steve Capabianco. He does a ton of just constantly like adding things to their curriculum and just adding new and innovative stuff. And it was really cool to see the movement stuff from them, their point of view, which they've kind of blended a lot of the techniques together. TPI, Titleist Performance Institute's another good one. That's kind of again tied in with SFMA as well. And then there's a clinician portion and a trainer portion of that one as well. Got it.
Nice. Very cool. Now, do you have like trainers in your practice, or is it just chiropractors?
So we do. We're trying to expand our practice so we can have personal training. We have I'd say like 1,000 square foot gym right now currently, and it's enough for me to take some of my players one-on-one, because I'll do which I've started doing a lot more of lately, is like an hour and a half of training, hour to an hour and a half of training with a player, and then do the treatment right after. So that's I said a lot of my appointments have become 1 hour, but a lot of them have become 2.5 hour appointments, because I'm doing the training as well. All of our docs are some sort of coach. So Dr. Ryan is into bodybuilding, and he's an Orange Theory coach. And Dr. Stevens, a CrossFit coach. And my wife, she was a movement coach at a local gym as well. So we all have that background, and we all kind of train a certain amount of patients here and there. We're going to start adding personal trainers though, so we can have more of a clinic gym hybrid.
Very cool. Now, when you say training, is this a mix or blend of rehab training, or is this just more like progressive loading training?
Both. Yeah. So, if I have an injury, it'll be, a patient, like a player that's coming back from an injury. Like I had a basketball player recently that is getting ready to get sent back to the G League because he was injured. So we did a lot of rehab for the knee at the same time of a general strength conditioning program to kind of get him up to speed before he went back to camp. So, and then it's just off-season training for some of the players right now. So some of the guys that are in town.
Nice. That's very cool. Yeah, that'd be the dream, is to have that. Was that something that's always been built out in your practice? Was the gym with the practice?
We've evolved it. We kind of knocked the wall down, made it a little bigger. Now we're wanting to knock another wall down and make it a lot bigger. So if we stay in the current location we're in, we're gonna probably go from 1,000 to like a 2,500. Yeah, like a 2,500 square foot facility.
Awesome.
So don't want to be too big, but
Yeah.
you want to be able to kind of have a good flow between patients and people getting personal training.
Sure. Yeah, definitely. Yeah. Give some space. It's not everyone's all crammed in.
Yeah.
That's pretty good. Well, man, this has been a super valuable call. I want to get in, if we want to wrap this up, why don't, if you have to talk with someone who maybe they want to get, I think we talked about the soft tissue stuff. You can do that with athletes or non-athletes. Same thing with the movement, doing the movement assessments and figuring out how people are moving. I mean, we can go on and on and on about why movement's important and a diagnostic tool of that. But with the athlete component, how, particularly with how you've gotten to work, I know a lot of that has been word of mouth, getting the professional athletes, but how has, if you could talk to a student who may want to go down that avenue, what would be your advice to them, how to network, how to appropriately position themselves to get into that space?
That's tough.
A little bit of luck too.
Yeah. It's a lot of just being in the right place at the right time.
Sure.
Like I said before, just be a good human and take care of people. Be nice. And when you create relationships and interactions, just kind of use those. Don't use those as like a, in an abusive way, but just kind of, find the right connections, whether it's through being a trainer or a coach somewhere, volunteer. I volunteered a ton for like coaching. I helped coach at a local college here at John Carroll for wrestling. That's been awesome for me to kind of, spread my name in the area because I'm not from Cleveland. So that was very helpful, and just get to different networking events. There's BNI, I think that's what it's called. Just different networking groups you can get in with, and do things like that, and just talk to people. If you're good to people, people are going to be good to you. And if what you do is, if you're helping people, if you're helping change people's lives, then they're going to talk about it, and they're going to, spread your name more than you need to. So that's my best advice.
That's good advice. That's really good advice right there. Yeah, I think that's, man, that's just what you said. It's so simple, but it's so true. And I feel adhering to that will just take anyone far places and make a deep impact and get people well. Yeah, very awesome, Dr. Chad. Well, hey, this has been really awesome getting to have you on. I'm sure we could have gotten a lot deeper with a lot more stuff, but if people want to get a hold of you or just kind of follow you around, what's the best place to do that?
I have an Instagram, and it's Dr. Chad Teague, Chad Teague.
Yep.
I guess you could probably connect that link or something. And then same thing with CodeChiro, our business, that has an Instagram. It's just CodeChiro. And then all of the doctors on there, you can kind of see our pages and see what we do and what we're doing. And I just recently started doing like a Calendly thing for, because I've had a lot of people in starting their businesses and just having a ton of questions. And even like with you, I'm just like, I'm sorry, I keep putting you off. So I've actually allotted a day for some of those conversations to have through Calendly. So if people are interested in that, they can get a hold of me, and we can kind of have some more in-depth conversations and kind of a business mentorship role. So
nice. Awesome. That sounds good. And I'll put all of that, links to all of that down in the show notes. Check it out. But awesome, Dr. Chad. It's been a pleasure to have you on.
Thanks for having me.
Yeah, always. Hey guys, I hope you enjoyed this interview. If you did, give it a like, and I'm curious what your biggest takeaways were. Leave those in the comments below. If you're new to this channel, welcome. And if you want to see more videos regarding chiropractic, health, and everything in between, consider subscribing. Thanks guys, and I'll see you in the next one.